Can you tell me what your name is and what you do?
I'm Nick Alberto, Chief Operating Officer for the Ambrosia Treatment Centers. I'm also recovering addict and alcoholic. I've been in recovery since January 4th of 2006.
Okay. We just saw some pictures of your cousin Gene. Can you tell us a little bit about him?
Gene is the oldest of four boys. Those are my four cousins. He was the oldest. He was, kind of like the older brother to us too as well. I come from a family of three. He had some problems early on. He was in and out of rehab as a young child. He was in and out of psychiatrists from the age of 9 or 10 years old. He had some issues, but he was very creative. He was an artist. He was a phenomenal artist. Paintings, drawings, but he had a lot of deep, dark, I guess, hidden demons that was going on. I mean, but he kind of fought through it. He fought through it with the help of a 12-step program. But he was in and out. He never devoted himself fully to that. Got through it. Married at a pretty young age. Had two young children, two girls. Became a corrections officer in North Jersey. He had his ups and downs, but nobody saw what happened. Nobody saw that coming, what happened to him in May of 2004, I believe.
What substances did he use?
Gene battled everything. His main drug of choice was heroin, but he would kind of replace one drug with the next. He would, say, I'm not doing heroin, I'm just going to do Xanax and drink alcohol. And whatever he did to an extreme. He was that type of personality that you could not control, really. But he always replaced one drug or one substance with another. And went back and forth, and he would have, moments and maybe weeks or months or even a year or so of sobriety, and then just fall back off the wagon again, and just kind of go run at it hard, and the disease is progressive, so he just got worse and worse as the time went on.
Can you tell us a little bit about the day he died and maybe some of what happened afterwards? Maybe what it was like for you and the rest of your family?
Yeah, I remember. I remember it vividly. I was battling my own issues at the time. I probably had about 3 days clean and sober, which I thought was an eternity. And I believe he was about 36 years old at the time. He was going through a separation with his wife, so he was staying at his mother's house. And it was a nice day in May in Jersey, and we were supposed to have a barbecue. And I was excited because I actually had I finally had a family function. I was going to be able to attend and do something and be somewhat normal. And I was calling over there and waiting on the time to get over there, waiting to hear back from them. And then we weren't hearing back, so I call over again. And my buddy Ed, who was a family friend of mine, and my cousin Frankie, who was Gene's younger brother. And I answered. I said, what's going on? What time are we coming over? He said, Gene's dead. And I paused and I said, what do you mean he's dead? Like, yeah, he wasn't getting up. We went up to check on him. His little brother Frankie went to check on him, and he was blue. He was dead. And I remember just pausing and saying, my mother's going, what's the matter? She saw something on my face was wrong. I said, Gene's dead. And she just exploded. And and from there it was just like a dream. Everything was scattered, everything was blurry, and we ran over there. And he lived pretty much around the corner from us. The cops were there, and they were on the stairs talking to my aunt. She was crying. There's an ambulance outside, a fire rescue outside, and they said go up and look at him. And I went up there, and it was at that age I was probably about 24, 23, somewhere around there, and it was very traumatic to see somebody that you loved, and you respected as your older brother. Laying there dead, blue. It just was scary, and it was a whirlwind for the family. 3 days of viewings, and we're Roman Catholics, so 3 days of viewings, 4th day of funeral, and to see hundreds of people that you knew throughout your life, in one spot crying every day for 4 days straight, and to go through that is probably the most painful thing I ever had experienced. I lost my father at an early age, and this was worse because it's a kid that's not supposed to die before their parents. So that the impact it has on the family and the loved ones is
Did something happen the day that Gene was buried?
the day Gene was buried.
Mm-hmm.
Yeah, actually, good. Yeah, he that was the same day that, ironically enough, I believe it was about 13 years prior. His father died the same day that Gene was buried. His father was also named as Gene. It was my uncle Gene. He had the same issues. He was an alcoholic and an addict, and he had a heart attack and fell down the stairs in the same house that Gene died in. So it was kind of ironic, but it's par for the course when it comes to addiction.
In your past experiences trying to get clean and sober, can you tell us a little bit about what it was like dealing with the nurses and the doctors?
For me, I saw, in hindsight being 2020, of course, I didn't think this then, but now I realize as I work in the field myself, you see the difference of the nurses that are empathetic because they have family members or loved ones or they dealt with this before compared to the other nurses that don't. And then they're basically, I hate to use this word, but they're ignorant to this disease and how to treat it and how to deal with it. The nurses that were not prone to dealing with addicts and alcoholics usually treated us, we felt like scumbags already, and they treated us just like scumbags. And it's frustrating. Don't get me wrong. I know for myself that I put myself in some of my, or in a lot of my predicaments, but the nurses that weren't used to this did not help. I remember one nurse. Her name was Dottie. She worked at a detox, local detox in North Jersey. 55 years old, this big. She was a little pistol, but she was the one that, she gave you that tough love. That's what helps this disease is tough love. She was empathetic, but she treated you like a human being and said, and kind of like a mother figure to a lot of us there, and would just, say, listen, you guys have these problems, why don't we focus on the good that you have, not the bad, and she kind of pushed you through it, and that's the only type of help that an addict or an alcoholic such as myself would kind of respect, as somebody that gives you that tough love, but they show you they care.
This video is going to be seen by student nurses. So is there anything that you think is important for them to understand about addiction and alcoholism?
Yeah, first off, it's a disease. It was recognized by the American Medical Association in the mid-'70s. It's a disease that should be treated as such. Now, whatever manipulation or lies or fiending that's going on by the actual addict, you have to remember they're a sick individual. That's not them. There's a drastic difference between the person that's currently actively using to the person that's actually actively in recovery. There's a huge difference. The person that's actively using, it's not that person. They're not going to be that person if they get better. I wish you could see the before and after of so many people like I do. I get the opportunity to do that. Like I said, I work in the treatment field, and you see the person that comes in broken, helpless, hopeless, a non-productive member of society, and you see them come back in 3 years and say they have 3 years clean and sober, and they have a job, and they have a family, and they have everything that a so-called quote-unquote normal functioning member of society has, and it's probably the best feeling I get all day, and I have, and I get all year. That's what I do. That's why I do what I do, and I hope you guys, by seeing what this project presents, I hope you guys get a different view or a different outlook on the disease of alcoholism and addiction.
Okay, thank you for giving us
No problem.
a little bit of your experience, strength, and hope, and sharing some of your experiences with us today.
No problem. I'm here.
Thank you.